Thank you, Sarita, and thank you to the EWE Foundation for including this into the summit discussions today, and everyone for being here. I am Megan Loden. I am a mother to 19-year-old identical twins who have a rare genetic disorder. They were strangely not diagnosed until they were 16. So pediatric to adult transitions has always been a part of our discussions. From the very first day, it was not like, here's the plan. It was, here's the plan until you turn this age, and then we're going to do these things. So I do have I have some opinions about it. Full disclosure, I wrote a speech and then I threw it away because there are a lot of personal aspects to this that I think are very universal in my discussions with people. So I'm just kind of like winging it. So I appreciate everybody being here and listening to me for the next 10 minutes or so. So I did do a little bit of, I am professional. I did do a little bit of research when I agreed to speak on this topic, and was a little, not surprised, but like still surprised somehow that in Googling pediatric to adult medical care transitions, or, different keywords and things, I saw only 2 of the major children's hospital networks have an actual page on this that comes up on just a typical Google search without going into a rabbit hole. And surprise, surprise, our children's hospital wasn't one of them. So I think it is an important topic, because I did also see a lot of papers where people are talking about how do we effectively transition, especially children with complex medical needs, rare diagnoses, chronic illness. How do we transition those children and their families? Because families, caregivers, parents, grandparents, aunts, uncles, siblings, whoever, are going to be more involved than the average 18, 22-year-old, right? And I don't know about any of you, but at 18, 22 years old, I could barely schedule my own well visit with just a general practitioner. And then we're adding in multiple specialties and clinics, and they have to go to different places, and oh boy, it's a lot. Just this week, we took my daughter to an adult facility where she has her neurosurgeon, because she was 16, and that was the best surgeon we could find almost anywhere for their particular diagnoses. We go to an adult facility right out of the gate at 16 years old. So we go there for all of her follow-up scans. We get there and we're at registration, and they're talking about, different providers that we want records sent to. And I just basically had said, she's still at Children's Hospital for everything except for this right now. We're starting to talk transition for a lot of things with a lot of the different providers. And a medical professional who, she works in the medical field and has for decades, she says, told me, keep her there as long as you can. You don't want your kid over here. It's so hard to navigate these systems as a child who we are teaching to try to advocate for themselves and speak up for themselves if they can. And that's the thing too, right? With some of our kiddos, some of them can't. And some of them can, like my daughters, but they're not really cognitively exactly where they should be. They miss a lot of things. So we're teaching them to advocate for themselves when they may or may not really be taking in all of the information that is being given to them by their providers. And we're doing it in a way that is really very unsupportive of the caregiver being a go-between in a lot of cases. We've been very lucky. We've had a couple of providers that have been very good about that, very good about speaking to the child and then turning to me as mom and saying, all right, mom, what do you think? How do you think that, that really looks in her day-to-day life? But that's not always the case. And I know that. So we kind of are just all flying blind with this transition thing. At 19 years old, I'm trying to step back a little bit, and in pediatrics, that seems to work okay. letting her manage a lot more. But in adult care, something gets lost. Something is lost in the process, where I send her back for an MRI, and an hour later, which is, much longer than it should be, an hour later, she comes out of the room wiping her cheeks, and her face is all red, and she's just very upset because they messed up in 3 different spots on her veins to get the contrast in. And it's like, your first instinct is you should have told them to stop. Yeah, she should have, but she didn't, because she's 19, because she's still a teenager, and because we have a system that is set up to tell her that you're just automatically an adult when you turn 18. And now you need to figure out how to push back against those authority figures that you've been told for 18 years. They're in charge. You're supposed to listen to them. And when they're not in charge and you're not listening to them, it's because mom, who's really in charge, is saying, this is what we need to do. And we need to push back, and we need to fight, because moms, dads, parents, caregivers in this space, we are used to pushing back and advocating for our kiddos. But the kids aren't used to it. And they're not used to it at 18, and they're not used to it at 19, and they're not used to it at 20 or 21. I don't know when they're going to be used to it, but we're asking them to make these big proclamations of like having their having their ownership and their own autonomy over themselves, and they're just not there. It doesn't flip like a switch at 18, regardless of how cognitively they function as any typical 18, 19-year-old. Like I said, I couldn't have done it to this degree that a lot of our kids are dealing with. My other daughter, her twin, has started driving, and she's also 19. And she has started driving again, being seizure free for 90 days, which in Arizona is state law. And her medications are causing her some pretty significant mental health side effects, some pretty massive mental health side effects. And we have a follow-up with her neurologist, coincidentally, next week. And so I'm just taking it really easy in life, and really, really kind of paying extra attention to her and spending a lot more time with her and distracting her and things like that. She's 19. She doesn't want to change medications. She doesn't want to come off the medication she's on, because she's afraid that she won't be able to drive, because it's keeping her seizures at bay. And in my opinion, that is like a huge, it's a huge example, like a universal example of a 19-year-old making decisions with a teenage brain. She's making decisions with a child's brain that could have lifetime consequences. They have a big adult consequence attached to them. And I understand why driving is a huge source of independence. I do understand that fully. I'm the one that's driving her to and from work and picking her up at 9 and 10 o'clock at night, which is way past my bedtime. So I do understand that, but she's not looking at the bigger picture, because she is really just a kid, right? Like 19 years old. She's a kid. She lives at home. We pay for her college. She works part-time to buy her own shoes and her own, ridiculously expensive foundation and eyebrow pencils. Like, she is still dependent on us for everything except for this. I can't make her do something, even if I know it's right. I can't make her. So there are things that we have done that have helped us to kind of bridge that a little bit. Like, I can call her neurologist team and say, I have spoken to my daughter and I'm noticing these symptoms, these problems, and the nurse will go and speak to her provider and come back and have a conversation with me. And then we can include my daughter in the conversation. Of course, we're not making decisions without her, but we had to sign a HIPAA consent form, So it's something that, everybody signs when you go to the doctor, whether you're a child or an adult, you're all signing it. But when you are an adult, like I'm sure most people here know, when you're an adult, you sign it and you can sign that someone else, like, for me, it would be like my husband can know my test results, or they can talk to him about, symptoms or medications or whatever, if I went to a particular doctor for something. And for my daughters, it's myself that they can talk to me about things. And then we kind of like go through and note all of that with the hospital and make sure they all have record of it at every clinic. And I can talk about billing, and I can talk about meds, and I can talk about seizures and lesions and all the fun things. There's also what's called a medical power of attorney, which that would be something that would be more like, look into your laws. I would highly recommend consulting an attorney, which I am not one. But it might be good to have something like that if you are a parent or a caregiver for an adult, whether it's your child or even a sibling, something like that. And that is more of a legal route, but it's shy of taking away their ability to function independently, which is the name of the game, right? As parents, whether you have a typical child or a child with a myriad of rare disease or medical complexities, we want them to retain as much independence as they can, as long as they can. That's the name of the game. And so we don't want to come in with guns blazing out of the gate saying, well, we're going to go and get guardianship when it's not necessary. That's like reserved for later for many of us. For myself personally, that's kind of like, hopefully we never have to do that type of a thing. So we just kind of do those things. I make sure that every clinic that we go to, we start off with the HIPAA paperwork, and I have a discussion with each of my daughters when we have to sign that, which we renew every year. Every place has to do it every year, as far as I know anyway. So please correct me if I'm wrong. Every place we've been has been yearly, and every time I explain to them, this is what you're signing. This is why you would be signing it. This is what I can do with that paper. It doesn't entitle me to say, you have to do what I say, but it does entitle me to communicate with doctors and communicate about billing, which they never get right, that sort of thing. So yeah, but that transition is really hard. Those types of things will help make it a little easier, because then your child is just a little bit more supported. And as far as the parent being supported in that transition, for myself, honestly, for me, the biggest support is having a feeling that my child is being looked after and they're not just dumping them off on an adult provider, right? Like, we want to know that the next provider is capable and willing of handling their particular diagnoses, because one of them is pretty rare. And so all of the clinics, at least at our children's hospital, some of them you have to ask for it, some of them they just offer it up, and they start offering it up in the teen years, have lists of providers. And if you ask and you press and you dig around and press a little bit with the doctor and some of the nursing staff, they will tell you which ones might be best. I mean, they will say they're all great, but this one might be good for your child because X, Y, or Z, and they'll circle it and they'll tell you this is how to get in touch, and they'll help you kind of like manage that transition of like all of the medical records and documentation and all that stuff. So that is kind of really the bulk of how I can feel supported in it as I'm going through it, is just knowing that the next person that we're being quote unquote passed off to is actually as close to an expert as you can be in some of these more rare diseases, right? So yeah, that's kind of my, and it seems to be a universal, in many ways, universal experience with transitioning from pediatric to adult in the healthcare space with medically complex kids. So thank you very much. And I think we're going to have our panelists introduce themselves and then kind of jump into some Q&A. Yeah, if we could invite the panelists, Jonathan, Laura, and Jasmine, to come online. And whoever, I don't want to put anybody on the spot. So whoever wants to go first, I'm just going to mute. You go on ahead and introduce yourselves and tell us a little bit about what, how you find yourself here with us today. We're so happy to have you.
Well, I will jump on in. My name is Jasmine Hightower. I am a rare disease patient and advocate. I have sickle cell anemia as my rare disease. And I also have a background in social work. I have a master's degree and a bachelor's degree in psychology, and I'm happy to be here.
Awesome. That's a tough act to follow, but my name is Jonathan. I am an ultra rare disease patient. I have like Megan, like her twins, I was not diagnosed until I was 19 years old. So I had I had like a blanket rare disease diagnosis, but I found out after years of trying to get genetic testing that it was an ultra rare disease called 3-hydroxy 3-methylglutarol CoA synthase deficiency. There's no short-term name for it. It's just the long-term name. And I am a ultra rare disease patient, as I said, and I personally have experienced the transition from pediatrics to adult healthcare.
That's also a tough act to follow. My name is Laura, and I am a rare disease patient. I am living with an ultra rare disease as well as a just regular old rare disease. And similarly, I was also diagnosed sort of in that transition period. I was given my blanket rare disease diagnosis at 18 of having some form of Ehlers-Danlos syndrome, and then wasn't confirmed with a subtype until I was 23. And then I was given that I have the diagnosis of classical like Ehlers-Danlos syndrome, one of the ultra rare subtypes. And then just this past year at age 25, I was finally diagnosed with hereditary neuropathy with liability to pressure palsies.
Oh my goodness. Well, I'm so glad that and it's so interesting to have so many that were diagnosed during that time frame where we're all like talking about those transitions anyway. So Sarita, you did a fantastic job putting this together with this particular group here. And I also know Jasmine has a ton of thoughts that I'm excited to dig into a little bit. So with regards to transitioning, I'd really like to hit a little bit because I didn't realize how common this was until, 3 out of 4 of us have experienced this, my daughters and then the 2 of you. Could you speak a little bit to how do you feel that being diagnosed during that transition time, did that complicate it? Did it make it simpler in ways? Did you how do you feel like that really that time period, did that make it easier or harder or just, with all that transition of care?
I can jump in here. So for me, my diagnosis came during my first year of college. So I was also living away from home for the first time. Very fortunately, I went to a college in Boston. For those who are familiar with Boston, you might know that most of the hospitals are right on Longwood Avenue. My college campus was on a connecting street to Longwood Avenue. So I was within walking distance to some of the top specialists in the state and really some of the top in the country. So I think in a way that did help that I was in close proximity. So it made the balance of, being in college full time and trying to have a social life while also balancing this more complicated medical life. It definitely helped that I wasn't also adding having to travel or figure out how to get to these appointments because I also was not able to drive. So that was definitely helpful. And I think it was helpful that I had always sort of been, my parents did a really good job of keeping me sort of in the passenger seat of my healthcare, even from a very young age. I sort of very famously brought to my orthopedic surgeon I was in like middle school, probably like 5th or 6th grade, a surgical plan for a surgery that I needed that no doctor would do. And we got in with a new specialist and I made a PowerPoint presentation to tell this doctor how to do it. And by the time I got to the end, he turned to his PA and said, "She's right, like, let's book it." So I think my parents really empowered me from a young age, even before I had a diagnosis. So it made the transition into taking the driver's seat a little bit easier than it might have had I not been involved in those decisions.
That's great. And Jonathan, how about yourself?
I want to echo the same sentiment that Laura had said, because my mom was my primary caretaker growing up, and she also kept me in the passenger seat where I was involved in these conversations from a young age. I got the blanket diagnosis at 20 months old. So even though I had some inkling that there wasn't something totally right going on with my health, and we knew what it was, and we had an action plan. I was very lucky, like Laura, to live not as close as Laura did to a big city, but I live about 45 minutes outside of New York City. So I also had access to top specialists. And one of my specialists was the chief genetic officer at one of the big hospitals down in New York City. And for me, that really propelled me into the right direction, because I had access to that healthcare. I had one of the top specialists saying, this is what we need to do. I'm not entirely sure, but I'm not going to dismiss you, because this is actually happening. And they did a myriad of tests. I did not personally remember this. I was maybe 2 or 3, but I remember my mom had shared actually quite recently that they did a test, like a fasting test, to see how long my body can go without food. And the doctor hadn't really, he did it in the past, but with not with people who had my conditions or people who were that young. But since my condition wasn't studied on people my age, 2, 3, 4 toddler age, that they needed to, they wanted to try it out. My mom invested her trust into this physician, and my glucose dropped rapidly, and it wasn't, I think for my mom, it was really difficult seeing me plummet so fast, but they kind of got an inkling that I can't go super long fasting or without food and water, especially with my condition. So to echo Laura, I definitely agree. I think being in the passenger seat, but also being an advocate, saying this hurts or I'm not feeling well, just is one way to get started as a pediatric patient that you can carry on to adulthood.
That's great. Yeah, that's perfect. I love that, like saying like this hurts or something. Yeah, definitely. It's so simple, but very powerful as a pediatric patient, for sure. Okay, we have another question that came in. Why is it so hard to transition from pediatric to adult, specifically within these rare spaces? So Jasmine, you want to take a crack at it?
Yes, well, unlike my other beautiful co-panelist on here, I was diagnosed with my rare disease at a young age. I got diagnosed because of the Newborn Screening Act and process. So by the time I was 6 weeks old, my mom knew that I had sickle cell. But I think the really hard part about transitioning from pediatrics to adult care, and I might sound a little abrupt or something, so don't take that, but I think it's they go from thinking that as a child, you can't tell a story. And if something is hurting or something is bothering you, then it is. But when you get an adult and transition to 18 or older, they're more reserved in the fact of, are they really hurting? Are they really, is this really going on? Maybe it's a mind thing, maybe. So it's hard to do that even when you have a diagnosis, because they put that stigma on you that, you know, it could just be that they want pain meds or anything of that fact. And I think that, as Sarita was saying, gaslighting, it really is gaslighting in the medical field per se. They make it seem like, you know, as my mom would tell me, I am the expert of my body. So if I'm telling you that this is what's bothering me, then as the expert, I would think that you would want to do some research or sort of dive into it and see what is causing this. And not, as adults, sometimes we get very dismissive people healthcare workers and things like that. So it makes it harder, I think.
I love that you're like the expert in your own body, like you're in your body. Like why you're absolutely right. Why would it be at 17 and 364 days, everything I feel is validated and recognized by the profession. And then the very next day, I'm 18 years old and suddenly it's in her head. She's looking for pain medication. She wants attention. She has anxiety. She like all these other things. Yes, it is 100% gaslighting. 100%. Yes. Yes, yes, yes. Do either of you, Laura or Jonathan, do you have anything you want to, like, you're dying to add? Laura's already like, me, go on, girl.
So sort of to echo what Jasmine was saying specifically about pain management, that is one of the biggest differences that I've noticed in the pediatric and adult medical fields. So the pediatric hospital I went to and the adult hospital I now receive care at are quite literally physically connected. There is a bridge connecting the two, but they are worlds apart. I used to be able to go into the pediatric hospital after a dislocation and I would be immediately given something to help with the pain. Now that I'm in the adult care, I'll be left to sit in the waiting room for sometimes hours and not even be offered Tylenol or Motrin. And it's just like, it's a world of difference for hospitals that literally have some of these same providers. Some of my providers work at both hospitals, but the care that I receive is so drastically different now that I'm in adult care. And there's not as much of an emphasis on let's get this child out of pain. And now it's like, oh, well, this adult is probably just here for narcotics. And it makes it really difficult when you live with a very painful condition because they don't even offer like holistic supports at this hospital. My pediatric hospital offered a lot of like acupuncture and massage. None of that exists in the adult hospital that I go to.
It's almost like there must be a disconnect in like the actual protocol and process. Like patient comes in pain, pediatrics, pain management, and then find the problem. Sure. Whereas in adult care, it's like patient comes in pain, we need to find the problem. And I'm all for finding a problem. I'm not all about pain management without finding the problem. But you have to recognize that a patient in pain, whether 17 or 28 or 39, is a patient in pain, and that needs to be definitely managed. Jonathan, did you have anything to add?
Kind of had an anecdote to go off of that, just because some of my providers kept me on a little bit early into my 20s. There was definitely some flexibility. It wasn't my 18th birthday, then I was shipped off to adult care. But I want to say maybe this was last year. So this was last year. With my condition, I also have Crohn's colitis. It's also, the diagnosis is ulcerative colitis, and which is also a very painful disease. And it was very well maintained with my previous GI, my pediatric GI. We had a game plan, medication. As soon as I went to adult care, right out the door, they were questioning my medication, why he put me on the medication, this, that, and the next. And my mom had to work, so I had to go by myself. So that was the first challenge, getting in the door. I made the appointment. Making the appointment's not an issue for me. I'm very able-bodied. That wasn't the problem. The problem was getting the providers to listen to me. So it was fine. And then my mom had sent me a folder. She said, this is like the outline of your condition, because only 20 people in the world have it. So it's very rare. So it's not like they can just do a quick Google search. This was the information that my doctor, my geneticist, has provided me. So I go and I give it to them and they say, just hold on to the doctor. So this, that, and the next goes by. I do the vitals, basic routine. The doctor gets in, immediately questions why I'm on this medication. It's worked for 6-7 years. I was like, I don't know why you would want to change it. I wasn't combative. I was more along the lines of, is this what my adult GI care is going to look like? Is this going to be constant fighting of, because I'm an adult, all of a sudden everything changes? Just because yesterday I was a pediatric patient, today doesn't mean that my health conditions have gone away. So anyway, that was the first issue. And then the second issue is I gave the nurse and one of the medical assistants, I said, can you have the doctor read this over just so you know, and he knows what is going on with my medical issues, just so he knows best to treat me, because I do have some things that need to be addressed. Because he wanted me to have a procedure done just so routine procedure. And I had explained one of the things is I can't fast. So I said, I need to be admitted overnight. I need to get B10 because my body needs to receive the nutrients. I can't fast overnight. I can't fast for 24 hours. Totally dismissed it, said, we can't provide that, just did the run around. And I was quite disappointed because this doctor had excellent reviews, waiting list, whatever. And the nurse came back 5 minutes. We can't do that, and came back with the papers. Were not touched, nothing. So they ignored my needs, and they ignored that I gave them information about my rare disease and totally just said, basically, we don't have time for it. Luckily, I found a new GI in the same office as my old provider, and everything ended up working out. The nurse actually, at the new provider, not to make this super long-winded, when my mom was explaining my medical condition, she said, Miss, could you please stop? I want the patient to talk. Even though he's just coming from pediatrics, he has a voice to speak and tell me what's going on. So it was night and day. That was so long-winded, but it was an experience that really stuck with me because I was in this warm and fuzzy place with GI pediatrics, and then I went to adult, and it was a bit of like a tundra. Like, it wasn't warm and feely, like it wasn't. So I had to find my footing, and I had to reject a provider because they were not taking me seriously.
Definitely. And I think there are so many points in there that so many patients and caregivers, parents can totally relate to 100%. I can definitely, I see the nods of the other panelists. They're like, yep. Okay, so we have another one. How do you approach transitioning to adult care for patients with health conditions that may impact their ability to make medical decisions? Now, I know each of you are able to make your own medical decisions, but is that something that you guys have thought about, that you've all had discussions with like care partners or parents about in the future? I know every disease kind of has like a potential wide range of a trajectory. So like we've had discussions about that in my home with my daughters as a could be down the line type of a thing. So I'm just curious if that's something that y'all have had in your own instances, your own families.
So Megan, I know you, oh, go ahead, Jasmine.
Go ahead, Megan. Lauren.
So Megan, I know you had mentioned during your little talk about the medical power of attorney. So that is sort of how that conversation went in my family. Is we had that conversation pretty shortly after I received the initial diagnosis of, you know, because my parents are divorced, how I wanted that to work, if I wanted them to both have the ability to make medical decisions, if I wanted to choose just my mom or my dad, if I wanted to go with somebody else entirely. And it was a lot of paperwork, and we did end up consulting an attorney. And that is sort of how that conversation went for my family. We came at it from that angle of like, now we have this in place, should we need it in the future, even though
That's
in the
exactly
moment right
it.
now we don't
Yeah.
need it.
That's exactly it, Laura. I like that you pointed out in the case of divorce and things like that, because of course, if something, heaven forbid, happens to your child, like some major catastrophe for a typical child out walking in the street at 19 or 26 years old, they're going to call the parents. But when the parents are divorced and the likelihood of something happening where a parent does need to step in, unfortunately, is a bit higher when we're dealing with some of these diagnoses. And so it is important to have that in place. So I like that you had mentioned about divorce, because that's this, we have the same situation here in our home as well. Go ahead, Jasmine.
I was, for my family, what my mom, she's always done, she's always been very open about this with me. From me letting me speak to my doctor in pediatrics and telling them exactly what I was feeling and what was going on with me. And then she would add on what she thought and what she was seeing and things like that. But we've always had an open honest discussion about it. Because at the end of the day, whether you have a rare disease or you don't, you know two things are going to happen. If you're born, you're going to die some type of way. You don't know when that be, and we would like to hope that it doesn't ever happen or anything, but we know that's not going to be true. So for me, what I wanted to do, I saw that I was doing an internship at a dialysis clinic, and I saw the tension that it was within the family whenever somebody got sick and they couldn't speak or say what they wanted, and you had to go based off what you thought they would want and things like that. So I started talking to my mom about it. I got a medical power of attorney, of course. I also got, because my parents do not live in the same state as I do, I got it to where my parents and my friends, my close friends and family that are close to me in where I live, telling them the things that I want to happen. If this happened, if I can't talk, do this. If I can't eat, do this. If whatever the case may be. So that way, when it does happen, it's not a shock factor. And that's not one of the things that you have to worry about. And one of the last things that I did, which was really and truly the hardest one of them all, was finding life insurance. Finding life insurance for somebody with rare disease now is very different from what it used to look like, especially since a lot of people now have it to where if you have a pre-existing condition, some people might not accept you. You might not be able to get a term policy or things of that nature. And finding a life insurance policy was really, it took me a couple years to do it, and it was hard. But if I couldn't find that, my backup plan was to a family funeral home that my family used. I was going to go there and basically pay for my plot every month and things like that. So that way you might not have life insurance, but you do have a place where something is paid off, where that person can go and things like that. And talking to your loved ones. My mom, she has a safe deposit box where she has a list of me, my brother, my dad, my grandmother, all the things that we want if something was to happen to us. So that way people will know, because you don't know. And sometimes that can be a very anxiety factor and stressful factor when you're already in a stressful situation. So just being proactive and talking about it, it has really done a world of difference, especially whenever I'm sick or anything.
Thank you. Like, there's so many good points in there, and those are not easy conversations, any of them. The power of attorney, the life insurance, none of those are easy discussions to have in any family. Jonathan, did you have anything you wanted to add to that as far as how those conversations happen, if they've happened? If not, that's okay.
Yeah, I have a power of attorney. I'm very fortunate. I think this is a moment where I recognize how fortunate I am in my situation, because my mom already had done the power of attorney with my brother, who is on the autism spectrum, and our uncle actually is a real estate and estate will attorney. So that was never really an issue for me. And then recently, my employer actually provides life insurance, like a introductory life insurance policy. And these are things that I have thought of. These are conversations that I've had with my mom, with my siblings, with my partner about what if, because with my condition, it's so rare that they don't know the trajectory. I do my part to keep myself healthy. I stay on a low fat, high carb diet. I exercise, I do everything that I need to, but I have a low immune system. So a myriad of things could happen. But for me, I'm a very like honest and open person. I've had these conversations. I've said, this is what I want. And that's really the gist of it. I mean, I think I've had such a good support system with my mom who's kind of laid it out, who's had these conversations, because I've heard of people who haven't had the conversations like about transitioning to adult healthcare until they're 18, 19, 20, where I kind of had that conversation like 10, 11, 12, because we knew that my medical issues weren't just going to subside at 18. So I feel very fortunate that I'm in a good place. My health is in a good place right now. And the other thing is to mention that I just started a new job within the past few months, is that insurance is a big factor, just regular health insurance. And I just was blown away because I just wrote it down before I came on. I have 7 different providers I have to visit for a myriad of different issues, and copays build up. They do. And you have to get blood work, and then sometimes I have to get ultrasound. So it all builds up. And now I'm very fortunate. It's one of those things where people who are able-bodied, they care, but they're just like, oh, I have to go to the doctor once a year, $20 copay. But for me, 20, that builds up. And just for me, when I found out I have a $0 copay on my prescriptions and $10 to go to the doctor, I'm like, oh my God, this is the best day of my life, because I'm gonna like be able to take a deep breath. So that's just my point of view. And I'm very honored just to be with Laura and Jasmine here, because they both have such brilliant perspectives on this as well.
Definitely. Like there's so much good stuff here, you guys. Oh my gosh. We have another question. So someone asked, I went through a mental health crisis and attempted suicide. I noticed shortly after that when I would go in for my appointments for other things, I was treated differently, or as if I didn't need the help. How can you make sure a doctor or nurse don't treat you differently, or do, acknowledge mental health? And I know, especially with mental health, it's so hard to navigate that under the best of circumstances. And then when you're really struggling and you really need help, to have a provider act like it's not true, it's not real, you're making it up, you're, attention seeking. I think a lot of that is similar in a lot of ways to that pain management thing, where it's like, it's not real, it's in your head. I think a lot of providers tend to do that. And I think it probably is more common in those young adult rare disease spaces, if I would venture a guess. And I'm not a patient, so I don't want to speak up. That's why we have a whole panel here. So I would love for any one of you to jump in, especially if you have any like firsthand experience or strong thoughts and feelings. I would love to hear it.
So I definitely noticed the difference in the importance of like paying attention to mental health was seen more from providers in the pediatric setting and less so in the adult setting. Like I know that I had much more access to mental health resources through my pediatric providers. A lot of those offices had, social workers, child life, mental health providers right in the clinic. And that was just like a normal part of a clinic visit might be like a check-in with a social worker. And especially in like sort of going back to pain management, because that was a big part of my childhood experience, was like going to a pain management clinic. The mental health aspect was a much bigger priority of it, rather than like, oh, go do physical therapy, even though you're in so much pain, you can't move your body and you can't get out of bed, and that'll make your pain go away. Versus let's talk about how you can overcome the pain mentally and just be able to move past it to even think and have hope. And that was definitely bigger in pediatric settings. And it's something that I wish adult providers would take more seriously, is the toll that having just living with a condition in general, but the additional toll of living with a condition that people don't understand or have never heard of. and how isolating that can be and how frustrating that can be. I wish there were more resources available, especially after you might have a negative doctor's appointment. I used to jokingly like schedule in like my planner after a doctor's appointment an hour of time that was dedicated to if I needed to have a good cry after an appointment where I felt invalidated or gaslit. I would literally schedule it in because there was no support available for that.
That's exactly what I'm thinking is like, you know, schedule in that time to like check in with yourself, because you're absolutely right. And we have been in both worlds in tandem for so long. And to be quite honest, until you said it, I hadn't even thought of the fact my daughters have therapy through their pediatric clinics. They have both had brain surgery at 16 years old. They have a lifelong, who knows, rare disease, a myriad of other things that have come from that. And not once has their neurosurgeon, who cut into their brains 2.5 months apart, not once has he thought, hey, how are you feeling about things? Is there anyone we can refer you to? It was an adult facility. He's an adult provider. It's just not valued in that same way. It's not, I don't know that it's that they don't care. It's just not, it's not in the forefront. Like in pediatrics, like you were saying, they have social workers, they have counselors in clinic, they have child life specialists in clinic, and that's in the forefront of their mind every moment of the day. And so I think it is just a very different perspective. And it's so hard to make them take that seriously in those adult spaces. And I wish I had a fantastic answer for the person that asked this question, because I know it's so important. Jonathan, Jasmine, any insights there?
For me, I would say this, as somebody that has been on both spectrums, on the inside and the outside when it comes to that. I like to, whenever, if I am looking for a provider or have my own provider, I like to get their take on how do they feel about biopsychosocial. I learned that in grad school, and basically everything that we do, it's connected. So if you don't think that my mental health is not connected to how my actual rare disease is, you have another thing coming for you. And that means I don't need to be in your space, really. And another thing that helps, I think, also is when you do have a specialist, and you have a lot of specialists, especially for mental health specialists, sign the letters so that they can communicate with each other. Hey, this person just came to a session today. She was really in a really bad place mentally. It seems like it may be stemming from pain or stemming from a medical diagnosis. Can we get together and do this work together type thing to get her or him back together? And just sending the notes and stuff. And I found that whenever I do go to a specialist and they send the notes every time I go to each other, it's sort of like a combined effort, and everybody is doing it together and on the same page, and don't have to ask you, okay, when the last time you went here, what did they say? And you might not necessarily know everything or remember everything they said or anything like that. So that's my little take on it.
Yeah, yes, might not know or remember. That sticks out. Might not remember. I can't barely remember everything. I'm always like writing notes. So yeah, I think that's a good point that I hadn't really thought of, is to have your social worker, your counselor, your therapist openly communicate like, hey, your patient is really struggling because of X, Y, and we think it might be because of X, Y, or Z that's in your wheelhouse. How about we have a conversation to get this patient feeling just a fraction better about their life right now? How about we try to work together, teamwork, y'all, taking it back to kindergarten, teamwork, right?
Yeah.
So, yeah, that's great.
And really and truly, the last couple years since the pandemic started, I have seen such a change in my healthcare experience because my team started communicating. It was like when I would go here and they would ask me what happened, but it's not the same when another physician can talk to another physician and they can get to go and running things off of each other and things of that sort. So I have found a big difference in my healthcare by doing that.
That's a great point. And I think I saw some nods. I think that's a pretty universal point. Jonathan, what do you got over there? I saw some head nodding.
I totally echo what they both say. I think it's mental health is such a big component. And I was kind of reflecting back, I was going back to my like childhood experiences of how I felt, because these myriad of doctors have followed me since I was 4 or 5 years old. From my memory, maybe they were beforehand, but I used to leave certain doctors feeling so defeated and so upset. And 2004, 2005, we weren't having conversations on mental health, especially in the pediatric realm. We were just like, it was kind of, it's no one's fault, but it's just kind of like, okay, like just go on and play. It wasn't really like, let's walk it through it. I had a mom who was very socially, emotionally connected. So I had that component. But even back then, she wasn't thinking, how is this affecting my child's mental health? She was thinking, is it making him sad? Is it making him frustrated? But there wasn't that deeper conversation. My best recommendation is go to therapy. If it is in your wheelhouse and you can afford it, and it's with your provider, or if it's through school or through work or through like a free clinic, go see somebody, because having that space where you can just talk, because when you talk to friends, it's great, but then your friends can loop it back to themselves. And it's, for me, I go to therapy. I just let everything out because that's the best way to do it for me. And that's kind of my biggest takeaway is go to therapy if you have the means and you have the resources, because I know not everybody does, and I know it's a privilege. And yeah, that's my big takeaway.
Thank you. Yeah, Sarita comments in the chat there. Let's be fair, cultural differences also prompt bias and stigma. A lot of doctors go in with those biases, add on mental challenges, and it does become disastrous for patients. Like we've all seen that in different ways. It displays differently from different doctors in different specialties and different cultures, socioeconomic statuses, genders. Like we've all seen that, right? Like at this point, I think everybody's aware it's happening. And how do we I think really at the end of the day, you just gotta, and it's exhausting. It is exhausting. And I know it's exhausting from a caregiver perspective. I can only fathom for the patient perspective. It's like, well, you just have to go and find a doctor that will take you seriously and look at you without all of those biases and without throwing their own stigma onto your situation. But oh my God, like, should we really have to work this hard? Come on, right? Can't we just have it? Can we just have one thing be easy? We cannot. No, we cannot. We cannot. I did have a question that actually I'd kind of like polled the audience of people that I know to ask, because I know a lot of, for those of you who don't know, I work for Angel Aid. So we primarily work with parents to children with rare diagnoses, medical complexities, that sort of thing. So I have a lot of networks of parents. So I did kind of ask a couple of people I know and repeatedly heard, how do you manage finding specialists to transition from pediatric to adult care? And I'm particularly interested in Laura and Jonathan's different experience then, and also, and I think Jasmine has a maybe more typical experience from that, but I definitely wanted to highlight in the last few minutes we have here to kind of like just talk about how that can look differently in different clinics and with different circumstances when depending on when you start that time, that transition time.
So for me, what we religiously did, and it worked out really well, is so my geneticist was kind of the home base. A lot of people use their PCP as a home base, but for me, it was my geneticist. He was well-versed in my condition, rare diseases. he only had a handful of patients. He didn't have 250 patients. He had maybe 10, because rare diseases tend to be rare, obviously. But my mom always said, and I always said, who do you recommend? Because he was 45 minutes away. So he was almost in New York City, and we live about 45 minutes like north of where he was. So we had to make that commitment. We were saying to him, do you think Jonathan's condition is severe enough where he should see somebody in your practice, or if he should go to somewhere local? And we kind of just based it off of his expertise, kind of as a guidepost, because he was well versed in rare disease, as I said, genetics, metabolic disorders, all of that. And it's really helped, because when my experience with the GI kind of went south, he said, just go see a colleague of mine. I'll put in a referral. And that really helped, being able to have somebody to give you those recommendations, because I know not everybody has that privilege to just send the doctor an email or give them a call. That's just, excuse me, I'm getting tongue-tied. That's my perspective of how it went. I'm very fortunate, as I've mentioned previously, because he just was able to guide us in the right direction and has never failed us. So
Thank you. And Laura, I imagine you have a similar sort of, yeah, go ahead.
So I definitely had the privilege of, my dad is in the military, so I have military insurance. So I was able to see a wider range of providers than someone who may have your more typical health insurance. And I didn't need to get referrals to go to these providers. So that saved like a lot of the red tape that I have a lot of friends who have had to deal with. So my sort of go-to was looking to support groups, different like Facebook groups or other networks of people who had the same condition as me, and basically said like, hey, here's these like 6 doctors that my current provider recommended. Does anybody see any of these people? Does anybody have any comments on any of them? Who, is actually aware, who's willing to listen? Which hospital system is better? Because there's sort of like 3 or 4 main hospital systems in the Boston area that don't all communicate with each other. So sort of figuring out, yes, this specialist is better, but they're in a different hospital system. Is their office willing to communicate with this other hospital system that my other care is at? So really sort of relying on that village of other rare disease patients was really helpful, and turning to some local rare disease support groups in general to see, which hospitals have better patient advocates available who can help with this transition, which hospitals have, other rare disease patients that are going to that, I could meet and grab coffee with between appointments on long days. Those were all sort of things that I took into consideration.
That's a great point about ask the community. So I love that. Jasmine, in our last minute here, give us all your insights. Quick, go.
Me, I did it more typical. I was going off to college, so I did ask my pediatrician for somebody that he recommended in the town that I was living. It was in the same state, but it was about 4 hours away. Unfortunately, he didn't know anybody, which which didn't help me out. But after doing that, I got on social media and support groups, asked them. I asked different social workers that I knew worked at different facilities or places that were near there. So I was in Tuscaloosa, so I asked some people that I knew that maybe were in Birmingham that was 45 minutes away, if they knew somebody or a specialist or anything like that. I did find one, but it took me a while to get there, and I ended up having to go to the ER before I could get in. And luckily I did, because going through the ER, I found my specialist that I saw all the way through my college years and undergrad. Through that, because I had experience with the nasty doctor and things of that nature. But doing those things, I would suggest just asking people that are in the field and things like that, and their recommendation on, so how do they how did you like them? Do you know anybody that went to them? And things of that nature. And also asking them, the actual physician, when you go and see them, asking them hard questions. How are you going to be the one to get me to where I need to be? Are you okay with me staying on my regimen that I have now? What are your opinions and thoughts on mental health and me going to see a mental health specialist too, and things of that nature? You learning to ask them questions, interviewing your doctors and specialists, because in a sense they will be working for you, so you need to know if y'all align correctly and things of that nature. So do not be scared to ask questions. They, from my experience, they actually love it. They're caught off guard at first, but I take my little list of questions with me, and they're great troopers about it. They answer everything that I ask, and it gives me a better understanding and things to.
I think we lost Jasmine. Well, we know where she was going with it, and that's a really good point, actually, about interview your doctors, and that definitely helps. So thank you guys so much, the panelists, and Jasmine, who we've lost, and to Sarita and the team and everyone else here. That's it, I think. Yeah.
I'm so sorry, y'all.
There she is. I was just saying thank you to the team and to the panelists, you guys, for answering so many great questions. There's a lot of great information to talk about with this transition. And so now I think we're going to turn it over to Sarita and her team to introduce the next session. Thank you, guys.